we've got a special episode of the Oral Health Podcast today. As part of Smile Month, one of the big focuses is on food and drink and how nutrition and what we put in our mouths actually affects the health of our mouths. So earlier on, we heard from people from Recipe for Change. We're talking about sugar in products that we eat, but now we've got some very special guests from Edinburgh Community Food who are going to talk through some of the initiatives they are doing at the moment to teach people about nutrition and oral health. So I'm going to let you guys introduce yourself. Joe and Ahmed are here today. So Joe, if you want to take it away first, tell us who you are, what you do, and yeah, take it away.
Thank you very much for allowing us to be part of your podcast. We're very, very excited at Edinburgh Community Food to be working alongside Ahmed at Linknet Mentoring to deliver a project called Eat Well for Oral Health. So I am a Food and Health Development Officer at Edinburgh Community Food, and I am a nutritionist. So we like to support people in our community around understanding the health benefits and around eating a healthy, balanced diet. And of course, it's really important for us to get those messages out. That's really important to focus on oral health, because a lot of people, when we think about our oral health, we're just thinking about our toothbrushing routine. And although that's like vitally important, the other real importance is what we eat and drink.
Absolutely. What is the involvement with Linknet in this Eat Well for Oral Health?
So I work as an oral health development officer with Linknet, and we are in partnership with Edinburgh Community Food delivering this project. So Linknet is more of a charity that is focused on the ethnic minorities. So I think this partnership brings, the expertise of Edinburgh Community Food with the local, communities, but also from our side, we try to, approach those ethnic minorities and the third sector organizations. And I myself am an overseas dentist, so I kind of try to bring my expertise in that area as well. Yeah.
So you've got the dental knowledge, and Joe, you've got the nutrition knowledge, and then I imagine it's quite a perfect combination then running these classes. So let's talk about it. What exactly is Eat Well for Oral Health?
Okay, so Eat Well for Oral Health is actually a project that's come about after a pilot that we did a few years ago that was funded by the Scottish Government. What Edinburgh Community Food did was we run cooking groups in the community to help people build their confidence around cooking skills, cooking food from scratch. But we always have a nutrition element as part of those cooking groups. So when the opportunity came to run the pilot to incorporate information around oral health, obviously we were talking a lot about sugar in foods, how to reduce the amount of sugar that we are intaking, learning about food labels, and making people aware of what the maximum intakes of sugar that's recommended for different age groups. So we started this pilot, and at the same time there was other organisations across Scotland doing similar projects to help oral health in vulnerable communities. And at the same time, Linknet were running their own project, which was separate. And once the pilots had finished, the Scottish Government then asked Edinburgh Community Food to join partnership with Linknet Mentoring to then develop a combination of both our projects and to spread it wider than Edinburgh, which is really, really exciting. So we've been working jointly with Linknet Mentoring for the past 2 years. We're now into our third year of funding, and the project aims to work with vulnerable communities and reaching out to ethnic minority groups to primarily provide oral health messages and nutrition messages that are simple for people to understand, given consistent messages in a fun way. So a lot of our project is around cooking groups, giving people the confidence to cook, learning about new foods, giving them easy, low-cost recipes that are healthy, that are lower in sugar, for them to then have the confidence to replicate those recipes at home. And obviously where Linknet comes in, Ahmed gives his oral health expertise to that. So we run cooking groups, but in addition to that, Edinburgh Community Food, we also provide weaning support, fussy eating support, so that we can speak to parents and carers with children at a very young age to try and get them into good habits while children are very young, to help support their oral health and their overall health.
In addition to what Jo mentioned, so as she mentioned that there was like private pilot groups that we were working with and projects. So in this project, what we're doing along Edinburgh Community Food, that we're providing these cooking sessions, and we're trying to deliver, in each, week, the key messages for the oral health that I even noticed in your website, that it's very similar. And I think it's a universal thing, but, raising the awareness with, the local communities. And I think most of the issues that happen, that people are lacking the knowledge of it, they're lacking just the awareness of it. So once they know it, they can make their informed choices. In addition to that, what we're providing is that we're trying to connect with ethnic minority organizations. So we try to reach those coming from, diverse groups, either immigrants, asylum seekers, refugees, and also, we try to advocate for them in registering to dental practices, which is, a very challenging issue right now. So that's what we try to do, and hopefully we could, deliver some help to these communities. Yeah.
I have to say as well, it's lovely to hear a dentist getting involved with community outreach programs. As we hear from so many different like community teams and the nurses and the hygienists going out and doing all of this stuff. So it's lovely to hear someone like yourself getting out involved in the community as well, in a different way as well, with the nutrition side of dentistry, which isn't something that I think a lot of people really, like you say, Jo, consider. It's more about toothbrushing, not about the food we eat, but that's a huge, obviously, part of keeping teeth healthy. But I'd love to know actually as well what the interests and things has been like in the classes and the different activities you've run so far this year. How many people are you expected to reach? I know you're saying the plans to move outside of Edinburgh. Has that started yet, or what's the plans for the expansion of the project?
Yeah, so in the first year we worked with, it was a part year in the financial year that we actually worked out in the community, because we had a bit of planning to do before we did that, and we reached about 80 families during that time in terms of face-to-face cooking, nutrition groups. But in addition to that, we had other families that we worked with around fussy eating and weaning, and it went out and spoke to other people in different organisations to raise awareness of oral health and nutrition. And in year two, we reached about 130 families, and we started to move outside Edinburgh. So in the Lothians, East Lothian, Mid Lothian, West Lothian, we went out and ran groups within the community. And what is really interesting is that we encourage community groups to have a member of staff or a volunteer within that community setting to join in as well, so that they're learning what we are doing in terms of the types of topics that we're talking about, the messages, to give them the confidence to support families going forward. And also what we're wanting to do in this year, in year three, is to spread it wider, but also train community members or staff or community workers to have the nutrition knowledge, have the oral health knowledge, to give them the confidence. And if they want to run a cooking group, to give them the skills in order to do that, so that they can deliver it in their own communities going forward. A lot of community groups already do a lot of food work, but they might not necessarily be thinking along the oral health lines. So it's really important that we can support people to deliver that ongoing, because we're a small team. We want to reach more people, but we obviously need to train people in the wider communities to be able to do that as well. So it's just really about giving people consistent messages. And I guess at this moment in time, where we know that there are challenges in accessing NHS dentists, that we really want people to help themselves to prevent any issues with their teeth and their mouths before it gets to, a painful stage. So whatever they can do to prevent is really helpful.
100%, 100%. I mean, NHS access, I'll be honest, I'm not sure what it's like in Scotland off the top of my head, but obviously in England and where we're based, we hear a lot of stories, unfortunately, that come through us of people really struggling. And I think you're right in that the knowledge isn't necessarily out there in the community groups about oral health and nutrition. Most of the nutrition things is about body and eat your 5 a day and balanced diet and all of the standard nutrition advice, but actually being aware of things like smoothies, and actually smoothies can be really bad for your teeth because of the amount of acids and things in there. And people often are shocked by even just simple things like that. So I think the more knowledge that we can get out there is absolutely beneficial for everybody. I don't know, Ahmed, what about yourself? What are you seeing the
So
impacts?
adding to Joe's point, actually, in our recent meeting with Tom Ferris, he mentioned a very interesting terminology, which is like oral health champions, which is, these champions in the communities. I think what we're doing is, as Joe mentioned, that we have a limited team, so we cannot approach everyone. But by training people and creating that, championing of the oral health and as well as the food aspect of it, that I think we can make the biggest impact, because it will be a sustainable impact rather than just, a cross-sectional or just a point of time that we do this activity. So yeah, I mean, in terms of the reach, we supported lots of people in regarding of the the registration to the dental practices, around 100 households right now in the since the start of the project, which is, I think, a good number, but we're still trying to do more. But at least providing them with key messages that they can apply daily to their lives, and preventing what they can prevent in terms of their oral health and their food practices. That's, I think, the most important thing right now.
What kind of feedback do you get from the people that are actually coming along and taking part?
We've had really positive feedback from participants. So some of our groups we run just with adults, some of the groups we run with parents, carers with their children, and we wanted to make it a fun experience that people can learn and tailor it to their own needs. So sometimes we'll work with specific ethnic minority groups, sometimes it'll be a mixture, but we'll tailor the sessions accordingly. And so the feedback's been very good, positive feedback from parents, but also from community staff as well. We've also worked in a high school with additional support needs children, and the teacher's response was, that the children really enjoyed their sessions. It was a great opportunity for them to not only improve their cooking skills, but also learn about healthy eating and how it relates to their oral hygiene as well. So we're getting lots of really good feedback, and from the children themselves, we've worked with in their cooking sessions with children as young as 4, and they're just such great fun, and they really get their parents involved as well, and they just love it. In terms of the weaning stage, then parents, it's a quite an anxious time for parents anyway, moving on from breastfeeding or formula feeding their babies on to actually starting them on solid foods is a naturally anxious time for parents. And if we can give them some support and guidance of the foods that we would want them to encourage to offer their children and less of the higher sugar baby foods that we know are out there, then we want them to get off to a really good start right from the very beginning. And I think parents are really grateful that we are able to support them and guide them in that. And also we've supported professionals in fussy eating support as well, because we know that a lot of families have a stage where after they've weaned their babies and they're all excited to try new foods, they go through a bit of a fussy stage, and we've been helping professionals to support the families that they're working with in that stage as well. So it's all about trying to reinforce the consistent messages around food and reducing sugar, increasing fruit and vegetables. Things that people know, but sometimes they need a bit of a reminder about, and why it's important for our oral health.
Absolutely. Yeah. What about you, Ahmed? What kind of impact are you seeing on the ground from these events? Especially, like you say, you've mainly focused on reaching like minority ethnic communities. And so, yeah, how are you finding the response to them?
Yeah, actually, because when the ethnic minority is coming to a new country, I think it's really important to explore the idea of exploring new food, new things, trying new things that are adjusting their recipes that they have already as a traditional recipes and adjusting it to be healthier. And I think that's a good thing to always consider, And I think there were so open about it, and they were enjoying trying new things that they haven't found, for example, in, let's say, in Sudan or any other areas, and they just tried, for example, the celery or new food. So it was great from that aspect. But also when it comes to the oral health awareness, there are a lot of things that they're learning, and they're happy about it. So I think there was an overwhelming positive feedback, especially understanding the link between the oral health and the nutrition.
Yeah, that's really encouraging to hear. And I know, listening to you both, you sound really, really passionate about it. And I know you're going to take it far and wide. And I wish you all of the best luck for carrying these events out throughout Edinburgh. Best believe we're going to be following along to see how you get on. And I know you've got some events coming up through Smile Month, your cooking classes and things. So I hope to see lots and lots of feedback and images and things from that. Now, before I let you both go, because I know you're both very busy, if anyone wants to learn more about these classes, either through Edinburgh Community Food or through Linknet Mentoring, where can they find you online? Where can they go and learn more?
Yeah, so we've got a website, edinburghcommunityfood.org.uk. We've got a page on there dedicated to our Eat Well for Oral Health project, but we're also on social media as well. So we're on Facebook, Twitter, Instagram. We've not quite got onto TikTok yet, but watch this space. We'll see what we can do. But we always like to share nice photographs and quotes and what we've been up to on our social media. So keep an eye on that. That would be great. Come and follow us. So on social media, we are at EdinComFood, and it's all on all platforms. Ahmed, you've got your own.
Yeah, so similar to Edinburgh Community Food, we have like our social media platform and also a page on our website. But there's also an interesting thing, which we have like the open badges right now by the name of the project, which is Eat Well for Oral Health, and that's an NHS Education Scotland in collaboration with them. So they also have it in their platform Turas, so people can learn some short learning courses there about oral health, nutrition, which is I think a good thing to to scale the project.
Thank you, Ahmed.
Yeah, that's fantastic. And like I say, I can't wait to see what more you guys do throughout Smile Month and beyond. This sounds like something that is just going to take off and fly. So I wish you both the absolute best of luck. And I hope that you have enjoyed listening to this. If you are curious or you're in the area and you think it might be really helpful, then please give it a Google, get involved. And I wish you both a very happy rest of Smile Month.
Thank you so much.
Thank you, Sophie. Yeah, thank you.